Lithium is a medication that in prescription doses treats mood disorders in people with bipolar disorder or manic depressive illness. And what these researchers found in Japan is that lithium is present in trace amounts in the normal water supply in some communities. And in those communities, they have a lower suicide rate. And so they're really investigating whether trace amounts of lithium can just change the mood in a community enough to really, in a positive way, without having the bad effects of lithium, to really affect the mood and decrease the suicide rate. Very interesting concept.
It's a trade-off society is making because of very, very high medical costs and a lack of willingness to say, is spending $1 million on that last 3 months of life for that patient, would it be better not to lay off those 10 teachers and to make that trade-off in medical costs? But that's called the death panel, and you're not supposed to have that discussion.
Short time ago, talk about medicating the public through the water supply or enacting death panels for the elderly still seemed outlandish. But now that the world is being plunged into hysteria over the threat of pandemics and overburdened healthcare systems, these previously unspeakable topics are increasingly becoming part of the public debate. What many do not know, however, is that the seemingly benign academic study of bioethics has its roots in the dark history of eugenics. With that knowledge, the dangers inherent in entrusting some of the most important discussions about the life, death, and health of humanity in the hands of a select few become even more apparent. This is a study of bioethics and the new eugenics.
Chair of the Department of Medical Ethics and Health Policy at the University of Pennsylvania.
That announcement meant very little to the general public, who likely only know Emanuel as a talking head on TV panel discussions, or as the brother of former Obama Chief of Staff and ex-mayor of Chicago, Rahm Emanuel. But for those who have followed Ezekiel Emanuel's career as a bioethicist and his history of advocating controversial reforms of the American healthcare system, his appointment was an ominous sign of things to come. He has argued that the Hippocratic Oath is obsolete, and that it leads to doctors believing that they should do everything they can for their patients, rather than letting them die to focus on higher priorities. He has argued that people should choose to die at the age of 75 to spare society the burden of looking after them in old age. As a health policy advisor to the Obama administration, he helped craft the Affordable Care Act, which fellow Obamacare architect Jonathan Gruber admitted was only passed thanks to the stupidity of the American public.
Okay, just like the lack of transparency is a huge political advantage. And basically, call it the stupidity of the American voter or whatever. But basically, that was really, really critical to getting the thing to pass.
During the course of the deliberations over Obamacare, the issue of death panels arose. Although the term death panel was immediately lampooned by government apologists in the media, the essence of the argument was one that Emanuel has long advocated: appointing a body or council to ration healthcare, effectively condemning those deemed unworthy of medical attention to death.
When I first heard about you, it was in the context of an article you wrote right around the time that the Affordable Care Act was under consideration. And the article was entitled Principles for the Allocation of Scarce Medical Interventions. I don't know how many of you remember, there was a lot of talk at the time about this new Obamacare was going to create death panels. And he wrote an article which I thought should have been required reading for the entire country about how rationing medical care, you think that that's going to start with the Affordable Care Act? Medical care is rationed all the time, and it must be rationed. Explain that.
So there are two kinds of rationing, you might say. One is absolute scarcity leading to rationing, and that's when we simply don't have enough of something and you have to choose between people. We do that with organs for transplantation. We don't have enough. Some people will get it, other people won't, and tragically, people will die. Similarly, if we ever have a flu pandemic, not if, but when we have a flu pandemic, we're not going to have enough vaccine, we're not going to have enough respirators, we're not going to have enough hospital beds. We're just going to have to choose between people.
When the debate is framed as an impersonal imposition of economic restraint over the deployment of scarce resources, it is easy to forget the real nature of the idea that Emanuel is advocating. Excluded from these softball interviews is the implicit question of who gets to decide who is worthy of medical attention. Emanuel's various proposals over the years, and those of his fellow bioethicists, have usually supposed that some government-appointed but somehow independent board of bioethicists, economists, and other technocrats should be entrusted with these life-and-death decisions. If this idea seems familiar, it's because it has a long and dark history that harkens back to the eugenicists who argued that only the fittest should be allowed to breed, and anyone deemed unfit by the government-appointed boards presided over by the eugenicists should be sterilized or, in extreme cases, put to death.
There are an extraordinary number of people whom I want to kill. Not in any unkind or personal spirit, but it must be evident to all of you. You must all know half a dozen people at least who are no use in this world, who are more trouble than they are worth. And I think it would be a good thing to make everybody come before a properly appointed board, just as he might come before the income tax commissioners, and say every 5 years or every 7 years, just put him there and say, "Sir or Madam, now will you be kind enough to justify your existence?"
This is the exact same talk of life unworthy of life that was employed in Nazi Germany as justification for their Action T4 program, which resulted in over 70,000 children, senior citizens, and psychiatric patients being murdered by the Nazi regime. In 2009, author and researcher Anton Chaikin confronted Ezekiel Emanuel about this genocidal idea.
So we'll do the same format. It'll be 3 minutes, and then time for questions. We'll start with Mr. Chaikin.
Anton Chaikin. I'm a historian and the history editor for Executive Intelligence Review. President Obama has put in place a reform apparatus reviving the euthanasia of Hitler Germany in 1939 that began the genocide there. The apparatus here is to deny medical care to elderly, chronically ill, and poor people, and thus save, as the president says, $2 to $3 trillion by taking lives considered not worthy to be lived, as the Nazi doctors said. Dr. Ezekiel Emanuel and other avowed cost-cutters on this panel also lead a propaganda movement for euthanasia headquartered at the Hastings Center, of which Dr. Emanuel is a fellow. They shape public opinion and the medical profession to accept a death culture such as the Washington state law passed in November to let physicians help kill patients whose medical care is now rapidly being withdrawn in the universal health disaster. Dr. Emanuel's movement for bioethics and euthanasia and this council's purpose directly continue the eugenics movement that organized Hitler's killing of patients and then other costly and supposedly unworthy people. Dr. Emanuel wrote last October 12th that a crisis, war, and financial collapse would get the frightened public to accept the program. Hitler told Dr. Brandt in 1935 that the euthanasia program would have to wait until the war began to get the public to go along. Dr. Emanuel wrote last year that the Hippocratic Oath should be junked. Doctors should no longer just serve the needs of the patient. Hoche and Binding, the German eugenicists, exactly said the same thing to start the killing. You on the council are drawing up the procedures list to be used to deny care, which will kill millions if it goes ahead in the present world crash. You think, perhaps, the backing of powerful men, financiers, will shield you from accountability, but you are now in the spotlight. Disband this council and reverse the whole course of this Nazi revival now.
That prominent bioethicists like Emanuel are writing papers that are changing the rules for rationing healthcare in the midst of a generated crisis should hardly be surprising for someone whose brother infamously remarked that you should never let a good crisis go to waste.
You never want a serious crisis to go to waste. And what I mean by that, it's an opportunity to do things that you think you could not do before.
But from a broader perspective, it is not at all surprising that the concept of death panels have been effectively smuggled in through the back door by the bioethicists. In fact, when you start to document the history of bioethics, you discover that this is exactly what this field of study is meant to do. Frame the debate about hot-button issues so that eugenicist ideals and values can be mainstreamed in society and enacted in law. From abortion to euthanasia, there isn't a debate in the medical field that wasn't preceded by some bioethicist or bioethics institute preparing the public for a massive change in mores, values, and laws. Research into the history of bioethics leads one to the doorstep of the Hastings Center, a nonprofit research center that, according to its website, was important in establishing the field of bioethics. The founding director of the Hastings Center, Theodosius Dobzhansky, was a chairman of the American Eugenics Society from 1969 to 1975. Meanwhile, Hastings' co-founder Daniel Callahan, who has admitted to relying on Rockefeller Population Council and UN Population Fund money in the early days of the center's work, served as a director of the American Eugenics Society, rebranded as the Society for the Study of Social Biology, from 1987 to 1992. As previous Corbett Report guest Anton Chaikin has extensively documented, there is a line of historical continuity connecting the promotion of eugenics in America by the Rockefeller family in the early 20th century to the creation of the Hastings Center in the late 20th century. The center, Chaikin points out, was fostered by the Rockefeller-funded Population Council as a front for pushing the eugenics agenda, including abortion, euthanasia, and the creation of death panels, under the guise of bioethics.
Eugenics practices that we saw and discussions and preparations for eugenics, which were going on in the United States in the early 1920s and earlier, going back to the late 19th century, those discussions were carried over, and the same discussions and preparations in England were carried over into Nazi Germany. After the war, after World War II, people who had participated in these movements wanted to keep the eugenics idea alive, and with the backing of particularly the Rockefeller Foundation, which had backed Nazi eugenics before World War II in Europe, they set up a population control movement that overlapped with the eugenics society and with eugenics ideas. And out of that combination of eugenics and population control was born the institutes and programs which are today at the heart of what's called bioethics, where you decide supposedly decide moral or ethical questions, not moral questions, ethical questions in a medical practice based on supposedly limited resources.
Love building people still a lot, but the good news is that the faster we improve health, the faster family size goes down. Love building people still a lot, but the good news is that the faster we improve health, the faster family size goes down. This equation has four factors, a little bit of multiplication. So you've got a thing on the left, CO2, that you want to get to zero. And that's going to be based on the number of people, the services each person's using on average, the energy on average for each service, and the CO2 being put out per unit of energy. So let's look at each one of these and see how we can get this down to zero. Probably one of these numbers is going to have to get pretty near to zero. That's back from high school algebra, but let's take a look. First, we've got population. The world today has 6.8 billion people. That's headed up to about 9 billion. Now, if we do a really great job on new vaccines, healthcare, reproductive health services, we could lower that by perhaps 10 or 15%.